All right. Welcome to the Florida State Oriental Medicine Association News 12. We've got some news to go through and over, and we'll see what's happening around the state and the country. So welcome. Our mission, FSOMA members are committed to improving the health and well-being of Floridians by advancing the practice of Oriental medicine and acupuncture. Your 2021 FSOMA Board of Directors. We have David Bibby tonight, your president. Jennifer Broadwell, your vice president, is here. Right now, I don't see any other board members, but Rafael Perez is your treasurer. Joshua Jackson is secretary. Hong Jen He is a director. Gretchen Gonzalez is a director. Demita Hartz is a director, and Omar Hay. So we're very glad for their service. I'm going to turn the proceedings over to David. He's going to talk about some news and a statement that FSOMA put out. And then Jennifer's going to talk about advocacy. So welcome, David.
Thank you, Ellen. And I want to thank everybody for joining us this evening. We're going to share some information, and then if anybody in attendance has questions, we'll address that at the end. So I wanted to start this evening, obviously, with the news out of Atlanta this week was very troubling. And I wish I could say that it was shocking, but in the absence of surprise, it's hard to be shocked. And so the question of hate crimes being on the rise over the last 4 years has been in the news, but there's been additional emphasis and attention after, the events of last year and all of the demonstrations in the streets, so much attention on different ethnic backgrounds and groups of people with historical challenges. There's more emphasis on attacks against Asian Americans in big cities and small towns, but there's more than just about 3,800 incidences reported since last March, and culminating with 6 women being shot and killed in the workplace in Atlanta. It's sort of reaching a crescendo, and unfortunately, it touches every demographic, every family, every life almost, when you see how much pain is being projected against different ethnic groups and minorities, genders. So FSOMA tried to put together a thoughtful statement regarding that and provide some resources for people to consider if they needed some assistance with mental and emotional distress, as well as places where they could go for up-to-date information as well. And so here, Ellen prepared us a nice slide with just gave us, unfortunately, some of the statistics, and that kind of raw data is shocking, really. Like I say, the 3,800 incidences since last March against Asian Americans. Looking at the statistics, again, African Americans, you have to think that only a portion, really, it's underreported as it is to say that 1,500 incidences in 2019 probably hardly represents an accurate number. I think everybody's aware of the daily challenges that African Americans have in this country, just going about their normal business. And when you think about physical abuse and partner abuse, nearly 20 people per minute are physically abused by an intimate partner in the United States. In 1 year, this can total 10 million men and women. So it's a pervasive and really disturbing figure to see that in black and white. Child abuse, of course, is another issue that needs more attention and more light, with more than 400,000 victims of child abuse. More than half of these, 60%, are simply cases of abject neglect. 10% of the victims experiencing physical abuse, slightly less than 10 with sexual trauma and abuse. More than 15,000 experience psychological trauma and maltreatment. So there's a lot of pain out there. And it doesn't come as a surprise, and we don't want to sound surprised in saying it, but it's, we felt like it was an appropriate time and way to try to share some resources for the membership and for anybody else who feels as though they would benefit from using those. Hopefully that our statement was helpful.
The
Thank you.
profound effect of stress on your health is,
Yeah.
mental and physical health is profound. So, so we did put out a position statement on social media. I'll be posting it on the website. It also will have some resources. I don't know if you want to read this, David, or just give people a minute to read it.
Well, I think, you know, these are some of the conclusions that we made in our statement. The statement has some, you know, before comments and some resources that come after again, but in keeping with FSOMA's mission to improve the health and well-being of Floridians, the board and membership are opposed to violence and promote peaceful resolution of disputes and conflicts. And FSOMA is against violence for any reason. We believe that violence is born of fear and misunderstanding, and this includes the recent violent attacks against Asian Americans and the ongoing violence of racism against African Americans, the culture of violence against women, and domestic violence against wives, children, and husbands. And obviously in life, disagreements are inherent, you know, but how we respond can either promote understanding and reduce conflict or increase it. And treating all people with respect and worthy of being heard is vital to this purpose. And so the FSOMA board, on behalf of our membership, wishes to clearly assert that it supports protecting human dignity, equality, and every person's inalienable rights to life, liberty, and pursuit of happiness. Sometimes words just don't go far enough, but we have to learn to love, understand, and appreciate each other.
Okay, David, I wanted you to talk a little about American Specialty Health. We've had a lot of discussions in the thing.
Yeah, thank you, Ellen. We've had some inquiries, and we've had some dialogue around the American Specialty Health Plan, which is a provider network. And the provider network, just so that everybody understands, is different than an insurance company. The provider network is what it sounds like. They do credentialing, claims processing, sometimes what they call a TPA, third-party administrator for insurance companies. And so if an insurance company wants to include a benefit, but they don't want to manage the provider network and they don't want to manage the processing and payment of those claims, they'll outsource it to a third-party administrator. And in this case, we're talking about American Specialty Health. And they have been around for a little while. It's a coast-to-coast company, and they do credentialing for a number of specialties in sort of like the physical medicine. That would include acupuncturists, chiropractors, massage therapists, physical therapists, and a handful of other therapists like speech and occupational health. And from time to time, you'll see podiatrists also included under those specialties. So this is an outsourced network that insurance companies use to manage those components of their health insurance benefits, but they do it outside of their core business. They allow American Specialty Health to resource, contract, and basically provide an in-network providers to service the needs of insurance companies' members. And so we see an increase in the number of companies who want to include specialty healthcare benefits like acupuncture and massage and chiropractic care. And American Specialty Health provides sort of a ready outsourced answer. And anytime you're outsourcing, there are a handful of reasons, but the primary reason is to reduce cost because the company is telling you that we can provide all of those services in a way that is more convenient and less expensive to the primary company. And so American Specialty Health has provider agreements, which are relatively straightforward, and a fee schedule that is going to come in. Typically, that's at less money than we would see on a corporate fee schedule or even the Medicare fee schedule. Certainly, it's the lowest of the reimbursement rates that I've seen, and they have a sort of a simplified benefit. And what the benefit looks like is you can use up to 2 units of acupuncture. It does not include any of the adjunctive therapies that we might be, familiar with using in our practice. Reimbursement comes in at about $40 for, basically it's a bundled reimbursement that covers whether you use 1 or 2 units. There's no second fee for a second unit. If you bill 1, you paid $40. If you bill 2, you paid $40. There is a $10 adjunctive service fee that covers unattended e-stim, which is like probably TENS, and hot cold packs, and maybe one other item, but they're $10. They do cover the E&M code as well, probably for both first and established treatment visits, and the scale on that is between, let's say, $20 and $40 per encounter. But my understanding of that is that it certainly won't be applied to every encounter. If you have a change in status or a reassessment of a patient at whatever the treatment interval is, they may reimburse for the additional time required to service that patient. So all in all, I think the average reimbursement is less than what most acupuncturists would consider typical for an individual treatment encounter. But I think that we have to be mindful in an instance like this before we dismiss American specialty and health out of hand, is to say every practice is a little bit different, and their physical space, their layout, their schedule, and how they choose to develop treatment plans around patient care for individuals who have these types of benefits. Because I think one of the things that we really need to keep in mind is that the insurance company, and certainly American Specialty Health, is not dictating that you spend 20 minutes doing your assessment with special dedication and purpose to pulse interpretation or any other aspect of assessment that is time consuming. They're not asking, and nor do they pay for us to use all of the tools that are in our toolbox, if you would, when it comes to strategies for treatment. They're being very upfront about what it is that benefit includes. And this is completely different than the treatment encounter that you're going to have with a private patient, somebody that comes to your office with a complaint and they're responsible for their own care. The provider can sit and discuss the treatment options, how involved a plan of care might be, what the relative costs associated with that are based on the procedures that are used, based on the investment of time that is used, the frequency or interval of care that's used, and come up with a treatment plan that will likely cost more money. Okay. In the end, you have to look, fairly, wide-eyed and clear-eyed at what American Specialty Health is telling to their members. They're saying you have an acupuncture benefit. We're going to pay for 1 or 2 units of acupuncture. You're going to have 6, 8, 12 treatments that are, in your plan, and that's it. That's what you get. And so it's not incumbent upon the provider, whether you're a physical therapist, a chiropractor, or any other licensed healthcare provider, to go above and beyond in every instance, providing care, procedures, and time in an instance where someone's benefits and the network that they belong to and the benefits that they enjoy don't cover that care. Okay. And so I think it's one of the things we're new to us as acupuncturists, because we're not used to looking at these arrangements that way, but you have to evaluate what care is available based on what benefit is available. And you can be open and honest with your patient about that and say, look, this is what your insurance company will pay for, and this is how that translates into care in my office. and design a treatment plan that reflects the benefit that their plan includes. Don't use your own, fully blown out, detailed treatment strategy in an instance where the benefit just doesn't cover that. It's not fair to you. It's not fair to the patient, and it's unfair to American Specialty Health. What they're not being underhanded about what benefit they provide. It is a budget basic plan. And so I would think it's, probably incumbent upon acupuncturists, as other healthcare providers have already figured out, to be creative in how we deliver care under those healthcare benefit strategy, those models. And it may look something like a group encounter. It may look like something like a timed encounter that, instead of being an hour, is 30 minutes or 20 minutes, something that reflects what the benefit actually pays for. Now, certainly you don't want to underperform, and you don't want to document something that's not accurate. So you need to develop a plan of care that, in my mind, fits the benefit that's available to that person, communicate to them why that's your treatment strategy, and just explain that if you're going to use this benefit in the office, this is what the treatment plan looks like. Now, without putting too fine a point on that, if you were to use a time on your schedule that made sense for you to see patients on more frequently than hourly, like you pick a Thursday afternoon after 3 and you have room to accommodate 4 patients in a large treating area, and you're going to just take and schedule your American Specialty Health or other budget type either provider networks or low-paying insurance plans in this way, and you're direct and clear with your patients about how you're going to do that treatment plan, you're doing the very best you can under the conditions of the insurance that they have. And no apologies need to be made to anybody. I think, feeling like you're being unfairly put upon or being asked to do things by insurance companies at a budget rate, that's not accurate. They're not asking us to do that. They're asking us to deliver the benefits, care based on the benefits that are available. So it's not right for everybody, but depending on the demographic you're working in, the part of the state, the frequency of the plans that use American Specialty Health. I know, for example, Florida Blue historically does not have it never had an acupuncture provider network. They would not let you credential with Florida Blue. Their Medicare Advantage plans now include an acupuncture benefit, and they outsourced it to American Specialty Health. So if you have people calling you all the time with Florida Blue, I think you might want to look at how it is that you can provide care in your community under the right conditions to help those patients and help your practice. Aetna also uses American Specialty Health. Baycare Plus, Molina, Provident, and a handful of others. There's a number of those companies. But my suspicion is that over time, the American Specialty Health model is probably a very successful model for insurance companies, because they're going to play a flat rate to American Specialty Health to deal with these whole question of specialty healthcare benefits. And more networks like this are going to be developed, and we're going to have to become increasingly creative about how we deliver care, service our communities in a way that's ethical, but also responsible for the building and security of our practices. Okay, guys. Anyway, if there's more questions on that, I would welcome conversation or discussions. Contact me directly. Maybe share some ideas about how this might be effective for you, or whether or not you just cut bait and not participate. Thank you, Ellen.
Had to unmute. Thank you, David. That's some good ideas. I'm going to turn things over to Jennifer for a little while. She has news from the ASA and news from AcuEd Day, and here we go. Thank you, Jennifer, for joining us.
Thank you so much, Ellen, and thanks, David. That was a great update on ASH. That was really nice. So want to tell us a little bit about FSOMA's Advocacy 2021 campaign and also talk to you a little bit about ASA's advocacy. And we've got some great definitions up here on the importance of advocacy and also what advocacy means. And really for us, advocacy is our message. And the biggest skill for effective advocacy is really going to be creating the relationships with your audience. So you practice advocacy every day. We all do with our patients. When you're telling them how you can help them, when you're asking and engaging them to participate and follow the recommendations that will improve their health, that being your message, that whole process really is advocating for their health and advocating to get them to follow along with what you're suggesting. And that process is made so much easier when you have a good rapport and you've already built that relationship with your patients. And it's really the same thing when we're looking for any kind of legislative change as well. It's going to be so much easier to get the time and attention of our legislators when we already have a relationship with them. So FSOMA's 2021 advocacy campaign is really focused on that. We really built it around facilitating and building relationships or deepening existing relationships to be able to prepare for our future here in Florida. And so we divided it into 4 quarters. Our first quarter was really about the basics. You know, the first part of any relationship, it's an introduction, right? You have to introduce who you are. So that's what we devoted the first quarter to. First, FSOMA introduced themselves in a welcome and educational packet that got sent out to all of our elected Florida representatives, so all 160. And then we followed that up with a letter writing campaign where we asked the licensed acupuncturists here in Florida to reach out and introduce themselves and write a letter to their legislators. We also had our Acupuncture Education Day, which we'll talk a little bit more about in a moment. And so for second quarter, we're going to focus on trying to really build up a library so that we've got some good content that's ready to go when we need support and we have something that we really want to go out and focus on. So we'll be doing a video on how to create video testimonials and also some written testimonials so we can start to house a nice little library of those. In third quarter, we're going to go back out and visit our legislators. Hopefully this time we'll get to do it in person, but if not, we'll walk you through it on Zoom again. This time our legislators are going to be home in their home districts. So hopefully there'll be a little bit more time and we'll be able to get those appointments set up. And then for fourth quarter, we're going to follow up with a strong email campaign that's going to help to position and tee up any of our legislative asks for 2022. And Acupuncture Education Day. This year we had to go virtual and it was quite interesting to pivot and do Zoom meetings. As you can see here, some people are better at taking Zoom photographs than others, but we did have a great time meeting with our legislators. And the Acupuncture Education Day really was, again, to kind of introduce who we are, introduce what our practice is like here in Florida, our scope of practice, who FSOMA is, and then also to try to personalize it when possible. So we did a great job of looking up to find out who our legislators were, and then what committees they were on and how we could kind of get a personal conversation going or some sort of personal touch there. And we had quite a few people join us and share their accounts. So we had some great times, and I think Ellen will be sharing more and more of those photos on social media, I hope. And so here in Florida, we really are so lucky. We owe such a debt of gratitude to those that came before us and really secured our Practice Act. We have a very robust Practice Act, and it's really important that we develop these relationships, maintain these relationships with our representatives so that we can protect our scope and so that we can also look for possibilities to expand our Practice Act when applicable. And perfect, you can go back to that. And it really is important because Florida is just one piece of the acupuncture profession. You know, when we look at ourselves nationally, we've got to be aware of what's happening in other states also. A lot of what's happening in other states is going to determine what can or will affect us here in Florida, and also is going to affect us in our participation for larger national programs, such as the VA and Medicare. And we really want to identify any trends that we can that are happening in other states so that we can see what we can learn and how we can possibly address them here in Florida, or what we need to do to be proactive. And really one of the things we're looking for also is how to identify a good national standard for us. And so we're going to take a look at three active bills right now in 3 different states. We'll start out with California, and this is Assembly Bill 918. And this was just introduced, and they actually just amended the original bill. And it is introduced by FSOMA and also Representative Fullerton. And this bill is really just going to be able to change the licensure, the exam for licensure. So historically, it was CALE and CALE only for licensure in the state of California. This bill is asking that it be either CALE or NCCOM for certification. And that brings us one step closer potentially to a national certification, which is nice. It could be very helpful for any people here in Florida that would like to maybe move and practice in California, and vice versa. It also plays nicely for some of the federal programs that are requiring NCCOM in some instances, because how else do we account for states that maybe don't have a Practice Act yet? So then we can take a look at Ohio. And Ohio, this is House Bill 442, and unfortunately this was signed already into law in January. In Ohio, the Ohio Association of Acupuncture and Oriental Medicine is working on an amendment. This bill is to deregulate the practice of Chinese herbal therapy. So it would become effectively unlicensed and unregulated part of the practice as of April 12th, if this does not get amended prior to. And this is really an interesting example of deregulation, which we are seeing here in Florida as well. And it's a nationwide trend. But in Ohio, they had a unique situation. Here in Florida, we have our licensure, our herbal medicine is put under our scope of practice. We have 1 license. In Ohio, they had 2. They had an acupuncture license, and then they had this oriental medicine license, which was the only place that they call it herbal therapy, that herbal therapy was listed and therefore protected. And an effort to not be redundant and to try to take out some of the, overregulation, so it was thought, they removed that licensure. And so that can threaten the practice for herbal medicine there. So it's something that we can also learn from here. And finally, and that is active right now with an amendment. They are seeking the amendment now. I do believe that they has a sponsor, and we'll keep you posted on any movement with that. And then we'll move on to Tennessee.
Do you know what the amendment?
I'm sorry, Ellen, I can't hear you.
Do you know what the amendment says?
Yes, the amendment would put the practice of Oriental medicine underneath the acupuncture license for Ohio, as long as you have either passed NCCOM's OM, or as long as you hold a current certification under NCCOM for either Chinese herbal medicine or Oriental medicine. So then you would be regulated by that practice under their acupuncture license. And so now on to Tennessee. Tennessee, we have House Bill 1275 and Senate Bill 1072. And this makes changes to the practice of occupational therapy. And this would include the practice of dry needling on the upper limbs for occupational therapists in the state of Tennessee. And it would also allow them some treatment diagnoses as well. Bill also includes some changes to telehealth for both occupational therapists and physical therapists. So this is one of the early cases where we're seeing occupational therapy going after dry needling. So again, something to watch for. All of our laws are state laws that govern the practice of us individually, and yet our fates are intertwined when we look at what's happening nationally and in other states. And so it's important to be aware of that. So That is what we have in terms of legislative. And then I wanted to just wanted to let you know that at the ASA, we also have been focusing on introducing ourselves. So ASA leadership, including ASA advocacy team and NCCOM advocacy, penned a letter that we sent out to the Biden administration, the acting secretary of the U.S. Department of Health and Human Services, and the acting secretary for Mental Health and Substance Abuse Health Services Administration, introducing the practice of acupuncture nationally and the ASA and the NCCOM. That letter is available on the ASA website, so take a look at that. And lastly, a Medicare update. We are in the final stages of drafting bill language with Representative Chu's office and working with stakeholders to make sure that we've got approval on that. And once that reaches the next stage, it would be going to Legislative Council to get drafted into formal bill language where we would be issued a bill number. So please stay tuned for updates on that. If there's any questions, please reach out. Happy to field any questions. Thank you.
Okay, I'm going to say a couple more things and then we'll open it up. First off, I want to talk about advocacy because this is something that's just seems to be difficult for acupuncturists to do, is to make that connection with the legislators. I know my first round at Acupuncture Education Day, I was anxious, nervous, didn't know what to do. We've got plenty of support online, plenty of board members that are willing to go with you to a meeting, coach you on a meeting. It's a person to person, making a personal connection. I've been hearing from a number of acupuncturists in the last couple of months about, I'm trained in acupuncture injection therapy. Why can't I help give vaccines to people? And the plain fact of the matter is they have no idea what we do as a profession. The legislators change over every couple of years. Somebody in your district 5 years ago may have known, but whoever their legislator is now may have no idea. So that's one reason we put out the package. We're trying to talk, but if you go talk to your legislator this summer, you know, there are a number of things you can tell them and educate them. We have 3 years of training or more. We have a master's level. We're kind of the equivalent of a physician's assistant in terms of how many years of training we have. And they just don't know this. You know, we saw this with the COVID restrictions. A couple of counties put us as personal care providers instead of healthcare providers. And it's because it's just not known. And FSOMA's working on this, but you know, we're between 8 and 10 board members every year. We can't cover everybody.
Right.
So I'm just doing a rah-rah for, you know, just make a commitment to talk to your legislator at least once while they're in office about acupuncture, offer to be a resource for them, you know, just get there and advocate to your legislator. You can't offer them free treatments. They can't do it. If you had a health fair, you could invite them to a health fair and invite them for a free treatment if you're giving them to everybody. But
yeah, that's a great distinction too. I'm so glad you brought that up. The reason that we can, because that's confusing sometimes, the reason that we can offer those free treatments in a health fair is because that's to anyone, anyone in the building.
Yeah. So hopefully next year we'll be back up in the Capitol giving treatments to all comers, including the legislators and their staff. But, you know, this advocacy.
I was going to say, the thing I would say about advocacy too, just quickly, is that, you know, this isn't about you know, having to put, you know, information under your arm and go pitch them on something. You know, you always feel like, you know, that may be some kind of a hard sell. This is the opposite. It's about extending yourself as a resource and an ambassador for the profession, where you're going to meet somebody and say, look, you know, you may be on a committee that hears healthcare, you know, bills, maybe not, but if you're asked about the question about acupuncture and you're uncertain about that, I want to let you know, I live and work in your community. I can be practicing for 2 years, 2 months, 20 years. I can be a resource to help answer any questions, and that's it. That's the long and short of it. Make that eye-to-eye contact, let them know that you're a business owner, you're a constituent, you're a voter, you're curious about what their agenda is, get them talking about themselves, ask them, say, what's important? Why did you come to office? What do you hope to accomplish? And just let them know that you're a resource in the healthcare and acupuncture space if they have any questions, and you're on your way. And you've done yourself, themselves, the legislature, and the profession a big service, because you never know how those relationships may blossom.
Yeah. So I just had to put a plug in for advocacy because it's vital for us, for getting patients, for getting support from the legislators, for just getting them educated. So,
Yeah.
right. All right. Enough of that. So thank you. I'm going to talk about save the date, August 13th through the 15th. We're planning a live conference in Fort Lauderdale at the Westin Fort Lauderdale Beach Resort. It's a beautiful venue. We're hopefully going to get the website up and populated with all the information you need soon, but we're still trying to finalize some details. We've already got 5 exhibitors coming, and we hope to have 20 or 30 more. So the 5 that are coming didn't come to the virtual one and signed up already for 2021. So it's a great venue. We have some great teachers lined up. If you go to FSOMAcon.com, you can see who the teachers are. I've got them posted. We just don't have all the rest of what you need to register. So, all right. A couple of classes coming up this weekend. Modern Pulse Diagnosis with Galena Rufner. It's a mobile ECG-based way to read an ECG according to TCM principles. It's great for expanding telemedicine possibilities. She's got a little book out about it. It's pretty interesting process. I'm planning to be there for part of it live and part of it virtual. Saturday, June 5th, Shelley Goldstein's going to be teaching us understanding and treating the aging face. It'll be a 4-hour afternoon workshop. Saturday, July 10th, we've got Love Your Practice with some experts on insurance billing, marketing, etc. So look for those coming up. I didn't put in the next Building Better Business webinar. I believe it's about, if you'll give me just a second, I can look that up. It's on the website. Oh, no, it's not yet. Hang on, sorry. A little behind on a couple things. Let me look one more place. I've got another. Collaboration with physicians. That's coming March 22nd. So it's going to be helping you to make connections to get treatment patients from physicians. And then understanding ED in the treatment room is coming March 23rd. And I'm just about to forget about another class. I'm glad I thought of this. Sorry I didn't think of it earlier. There's a digital marketing class. If you look in the e-news coming out, it's being hosted by Magic on Tap, and they are digital marketing experts, and they have kind of a coaching membership setup where they'll give you a free trial, and then you can see if it's something that'll work for you to really increase your web presence and social media aspects of promoting yourself. That's where people go now to look for you. So, okay, let me get back to here. I forgot a couple of our events, but look for stuff coming out soon on those things as well. And, we are stronger together. Encourage your colleagues, if they're not members, to join us. We have all sorts of membership plans available. And, the more we can come together and work together, the better off we'll all be. And I want to thank you for being members and for being part of the news tonight. And we have some chat information or chats, maybe some questions. Hang on and I'll pull those up. We'll stop the sharing. And sorry, I'm having trouble navigating.
I don't see any questions in the Q&A.
Nope, I don't see any either. Does anybody have any questions about ASH, about advocacy, about the conference, about anything coming up? We're happy to stay on and answer them. I think what I can do, I'm going to go ahead and see if I can make everything live so you can voice questions or you can still put them in. Let me just see. I'm going to go through and allow everybody to talk. If you want to share your screen, you can, but I'm unmuting you, so, or asking you to unmute. So please ask questions, give comments, give feedback. We believe everybody's opinion is valuable, and together we can all, you know, if we all put our minds and hearts together, we can come up with some awesome stuff. So any comments?
I think we're good. Angel, Dickie, you guys, thanks so much for being here.
Yeah.
And, I already said goodnight to Kim. Renee.
Donna, good to see you.
Yeah, Donna, how you been?
Jime Ha, good to see you. I hope you're doing well in your practice. I know you had some startup stuff, got you connected with some people to help. So, and Sherman Shaw. So.
Thank you, guys. This is Kim. I did have just one comment. Ellen, I sent you the information on the senators and the House guy that I was contacting from my area, and they never got back with me. In fact, I called again and left several more messages. So is that something you think we should pursue this year?
At least this summer, let's see if we can connect you. I'll connect you. This is Kim Netling, right?
It is.
I'll connect you with Corinne Mixon, and hopefully through her office, they can get you a response.
Okay. All right. Thank you.
All right. I'll put a note and send you an email out tomorrow to connect you with Corinne.
Kim,
Okay.
whose office were you trying to reach? This is David.
David, I can't remember right offhand.
Okay.
I just had them on my call thing if they didn't call me back.
No, that's okay. I won't, but
I've got their name, David. I'll give them to you if you want.
No, that's okay. Thank you, guys.
Okay.
We'll definitely help you. Anyone who's having trouble getting a meeting or getting a callback or communication going, we will definitely step in and help with that.
Yeah.
I would say two things. One is usually if you're not getting a call back, there's usually a reason. You know, they're really pretty good, and their staff and junior staff is pretty good about making sure the constituents don't get left out in the cold. But if maybe the in this case the senator is running difficult legislation and they're just back to back offices full managing technology, it's still no reason not to return the call and or to establish communication. But it's more unusual than not. Usually they go out of their way to make sure that constituents feel responded to.
Right. And so, I know that one of the guys is brand new, so he didn't really even have an office.
Working out of a closet, right? And so sometimes it's a little bit of the logistics and stuff, but there's certainly if there's a priority to meet and sit down and be heard, there are levers to pull to make that happen. So we can do that.
Okay, thank you.
If you give me just a second, I can. Senator Randolph Bracey and Representative Traveris or Trey McCurdy.
Yeah. Bracey is who we were just talking about, that's handling the amendment to the hate bill the hate bill legislation for 2021.
Trey is?
The Bracey.
Oh, bracing, okay. All right. Anything else? Anybody else? We'd love to hear from you if you have comments or questions.
Good job.
All
Thank-
right, thanks.
Thank
Angel.
you so much.
Thanks, Vicki.
So much.
All right,
Thank you, Renee.
we'll close it down and thank you all for attending, and I'll put the recording on the website and up on YouTube. So if anybody else, if you think anybody else needs to look at it, let them know. So thank you so much.
Thank you, guys.
Thank you,
Yeah.
guys. Bye-bye.
Hey.
Night.
Where you can enable us